Hey guys, it's cold out here. Getting up, just enjoying some sunshine. So I don't know, how's everybody doing today? Not doing too bad. Got me a little bit of a UTI. So with spinal cord injury, um, and that would be with anyone else with a catheter. Um, it comes with having chronic UTIs, and generally after a condition, my spinal cord injury, it's been 20 years, they become complicated. Uh, there's several different ways that catheters can work. They can go up through your privates, or I have what's called a suprapubic catheter, which is a small hole right above my pubic area, where the catheter actually goes and sits right inside the bladder. But what happens when our body has foreign objects, it gets infected, and there's no way around the of having UTIs and urinary tract infections when you got an indwelling um, device. So what happens is, just like many of us that are my age, a little older, is that when we took our kids, well, when they took us kids to the doctors just wrote out a script of antibiotics, sent you home. Didn't give you really much instructions with it, as far as make sure you take it until the whole script's gone, yada yada yada. And what it does is it causes the bacteria that we have to be resistant, and they evolve, they form resistance to the medications. And so with something like a spinal cord injury, you go in and you have these all the time, and they start treating. And in the beginning of my spinal cord injury, it was kind of like the reference I used of us as kids and our parents taking us to the doctors. They was open and willing to treat every infection that they culture and says that there's an infection. But the key factor in when you have indwelling catheters, or if you catheterize yourself daily, is unless you're having symptoms, you do not treat a urinary tract infection. A couple things and misconceptions about urinary tract infections is, they're not contagious. Um, you know, our bodies can, resist. They're not contagious through sexual activities, not contagious through toilet. I can't give it to Wendy. Um, but at the same time, they can still be very impactful. Um, our bodies react with immune system, white blood cells, and it goes and it attacks the virus. And generally, our body has the ability to beat off a lot of these infections ourselves. But with a urinary tract infection, with it being contained in the bladder, it's not as much of a threat. But our bladders are connected to our kidneys, so we have to be very aware and watch our symptoms very closely when determining whether to be treated, or just to hang tight on a UTI, because they can go up to the kidney, and then they can go systemic, and which is when it leaches into your bloodstream and you get sepsis, which is a nasty, nasty, nasty thing to have. Usually you have to be inpatient. Well, I think pretty much if you have sepsis, you're going to be in the hospital. You're going to be on some heavy duty antibiotics like vancomycin. That's one they usually hit me with. It's hard on the arteries. It's hard on the body. It's poison. They're poisoning our bloodstreams to kill an invader, and it's gonna have also effects on us. So I've got a UTI. Is the reason I'm making this video. The doctor just called me in, a couple antibiotics. I take one every week, which is just this drink I drank, phosphomycin, or aka Monoral. It's a maintenance drug. It's used to treat a bacteria that I have called Pseudomonas. It's found commonly in dirt. So another tip, if you are a spinal cord injury, or if you do have a suprapubic catheter, do not let your pets, just willy-nilly around your site, because, they carry it on their paws. Anybody that has had a dog and they end up with their dog's feet smelling really funky, they smell like corn chips. It's called Frito foot. Look it up, because it's a thing. It's the bacteria that is Pseudomonas. So I'm not sure if I was, pollinated by my little furry friend, or, I just wasn't careful. But so other things we're doing is trying to, increase water. I'm using iodine or iodine swabs to go around my suprapubic site a couple times a day. That seems to have been helping. I'm flushing my catheter out, which is the tube that goes into your body. Inside of the plastic, the bacteria will actually start accumulating, and the higher bacteria count you have in your body, the heavier attacks on your immune system, and just the viral or the bacteria load that your body's trying to carry. So, yeah, like I said, Monurol and nitrofurantoin, for something like that. That's to be used. I have a couple different. I have an infection, Pseudomonas, and then Mongol or something. It's another common UTI, and all these are is just common UTIs that a lot of us get, but after being over treated, and they turned them into little super troops. But anyway, we're gonna be getting to feel better. We're sitting out here. We got a little bit of sunshine coming up in the distance. I hope everybody has a blessed day. I love y'all, and we're gonna be doing this. Thank you all that like, subscribe, and follow me. You're really awesome, and you gave me a lot of inspiration on trying to do something with this. Thank you guys. Love you.